the assessment of the client, first, we're going to assess the level of consciousness of the client. And then second, we're going to check the client's medical record if there's any bleeding in the nostrils as well as the injury and the surgery. And then we're going to instruct the client to breathe through his nostrils, occluding with one finger. And then last but not the least, we're going to assess the client for any allergy to the latex. And then for the planning, we're going to assemble the equipment needed for the specific procedure. And then for the implementation, good morning, ma'am. I am Nurse Lloyd. I am your nurse for today for 8 a.m. to 3 p.m. So our objective for today is I'm going to feed you using a Nasogastric tube. So may I know your name, ma'am, as well as your date of birth?
Lolita Obando, September 1, 1959.
Okay, thank you, ma'am. So for the first implementation, we're going to raise the head of the bed to high collar's position to prevent or facilitate insertion of the tube as well as to prevent back straining. And then second is we're going to place a towel in the patient's abdomen or the patient's chest. And then after that, we're going to wash our hands, or we have to apply alcohol. And then we're going to don our gloves. Then after that, we're going to measure the NG tube. Starting from the tip of the nose, going to the earlobe, and then going to the xiphoid process of the client. So this method would determine how long or what is the length needed to reach the stomach. And then after that, before we're going to insert our tube, first, we're going to apply some lubricating jelly. It would facilitate comfort as well as prevent friction. Then after that, we're going to insert the tube slowly, and then we can offer the client a water as well as the ice cubes because swallowing facilitates insertion of the tube. Then after that, after we reach our tape part, we're going to use some tape to secure our tube and then to prevent displacement. To check the placement of the tube, we're going to get our 50 ml enteral syringe, and then we're going to attach it into the edge of the tube, and then we're going to inject rapidly 30 ml of air, and then at the same time we're going to auscultate the abdomen of the client for whooshing sound, because whooshing sound is a determinant that the tube is in the stomach or in the correct place. So we heard some whooshing sounds. Then after that, we're going to aspirate some gastric contents of the client. And then we're going to check it into the pH strip indicator. And then for a pH of 5 to 5.4, it indicates that the stomach is in the tube, or that the tube is in the stomach. And then if the pH of the client is 6 to 7, it indicates that the tube is in the intestine. So after that, you may also provide the client provides the client an X-ray for the abdomen to determine the client that the tube is in the stomach. Then for the gastric lavage, first we're going to get the 50 ml internal syringe, and then we're going to grasp the edge of the tubing, and then we're going to insert it. And then after that, we're going to administer a formula milk, making sure that the formula milk prescribed by the physician is not expired. So after we prescribe or after we administer the formula milk, we can use a 30 cc of water to flush the milk, and then to avoid the blockage into the internal syringe. And after we administer water, as well as after we flush the sterile water, 30 cc into the internal syringe, we're going to close the edge of the tubing, which is the clamp. Then after that, we're going to maintain the 30 to 60 minutes in a patient's position to prevent aspiration. And then for the gastric lavage, then we're going to attach the 50 ml internal syringe into the end of the tubing. And then we're going to apply or rapid apply of 30 ml of air. Then at the same time, we're going to auscultate the client's abdomen for the whooshing sound. So we hear some whooshing sounds. And then after that, we're going to aspirate some gastric contents of the client. And then we're going to place it in the emesis basin. And then after we place the gastric contents in the emesis basin, we're going to administer some sterile water for about 120 ml. Then after we administer 60 ml of water, we're going to let it dry. Let it drain the client's belly for about 1 to 3 minutes. Then after that, we're going to place it back in the emesis basin. Then another round of administering 60 ml of sterile water. And then place it back. So we're going to repeat the procedure as long as the results is clear. And then another one is we're going to close the edge of the tubing. And after that, we're going to dispose the materials that has been used in the procedure. Then for unblocking an internal feeding tube, first we're going to attach the 50 ml internal syringe into the tube. And then we're going to leave it for about 30 minutes to dissolve some medications and then as well as some plug food. And then we're going to flush the 50 ml water, warm water. And then we're going to use the method which is the push and pull method. Once the warm water is not successful, we can administer 50 ml of fizzy water such as cola. we're going to attach the enteral syringe with fizzy water. Likewise, we're going to use the push-in-pull method. If this method is not working, we can change the enteral syringe. Then after that, we're going to dispose all the materials that has been used in the procedure. For our evaluation, we're going to monitor the nutritional status of the patient as well as the response to the procedure. And then we're going to document the procedure as well as the response of the client.